Hi, I'm Dr. Ty Hunt-Caesar, Infectious Disease Specialist and the Virgin Islands Department of Health's Medical Director. Many of you may be wondering how the COVID-19 vaccines work and why they are important. The Moderna and Pfizer vaccines we are offering in the Virgin Islands are about 95% effective at preventing severe disease or death. Here are some things you should know. Like all existing vaccines, COVID-19 vaccines are safe. They cannot give someone the infection because these mRNA vaccines do not contain the live virus that causes COVID-19. Despite how they sound, they do not affect or interact with your DNA in any way. The vaccine prepares your body in case you become infected. It teaches your immune system to make antibodies so that once it encounters the virus, it's ready to fight it off. These antibodies stay in your bloodstream ready to protect you in case the virus shows up. The vaccine helps to give you immunity against the virus, and if you get infected, you won't experience severe sickness or death. When enough of us get the COVID-19 vaccine, the virus will have nowhere to go. That will slow the spread in our community. This is what we refer to as herd immunity. That's how we will get closer to ending the pandemic. To learn more about the COVID-19 vaccines, please visit covid19usvi.com/vaccines.
Good day. Welcome to the Government House Weekly Press Briefing and our COVID-19 update for the week of April 23rd, 2021. For the benefit of the radio listening public, my name is Richard Mota, Government House Communications Director. Joining me this afternoon is Dr. Esther Ellis on behalf of the Department of Health and Health Commissioner Justa Encarnacion to provide the latest COVID-19 vaccination numbers and information on where Virgin Islanders can receive free COVID-19 testing in the territory this week. But before I turn the briefing over to Dr. Ellis, I want to share some global news of the pandemic that has been of particular concern to us here locally. Today, the country of India recorded a new global high for daily coronavirus cases for a fifth straight day at 352,991 new cases. Many of the country's hospitals report not having any free beds, and others said they are not taking new patients due to continuing uncertainty over the supply of oxygen. A number of patients have unfortunately died in Delhi due to a lack of oxygen supply. The city's hospitals are in crisis. This is a tragedy unfolding as we speak, and despite the availability of the life-saving vaccines, people continue to die in India simply because they have not vaccinated enough people of their population quickly enough. Here locally, we are fortunate that we are currently at a 7-day positivity of 1.4% and can experience the benefit of that low positivity in the form of some loosened restrictions. But as we continue to see in the United States and across the globe, and unfortunately in India, this virus continues to claim lives. And that is why we continuously stress the importance of following the CDC's and our local health department guidelines. If we don't continue to follow recommended social distancing and masking requirements and continue to take advantage of our free access to the vaccine, we can easily take a step back in the territory as well. None of us want that. So I am asking for us all to remain vigilant and please continue doing the things that we know as a community has proven to keep us safe. And with that, I'll turn over the briefing to Dr. Ellis. Dr. Ellis?
Thank you. Good afternoon, everyone. And thank you to Governor Albert Bryan Jr. and Commissioner Justa Encarnacion, for the opportunity to share COVID-19 updates with you today. As of April 24th, 2021, the Department of Health has conducted a total of 100,455 tests, For the first time, we are reporting now over 100,000 tests ran within the territory. 3,090 individuals have tested positive, and 365 individuals have tested negative. There are currently 67 active cases in the territory. That's 41 cases on St. Thomas, 24 active cases on St. Croix, and 2 active cases on St. John. 2,996 cases have recovered, with 27 fatalities related to COVID-19. In the past week, there have been 40 new positive COVID-19 cases, with a total of 2,820 tests ran, which is a 7-day average percent positivity of 1.4%. From our hospitals, Juan F. Louis Hospital and Medical Center reports 3 COVID-19 cases with 0 vented, and Schneider Regional Medical Center reports 1 COVID-19 patient. Our surveillance efforts continue as our epidemiology team works to conduct contact tracing and investigations. Our epidemiology hotline remains open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases of COVID. On St. Croix, that number is 340-712-6299, or St. Thomas, St. John, 340-776-1519. We are still confirming new cases of COVID-19 daily within the territory. We must continue to remain vigilant and wear a mask, practice social distancing, stay home when sick, and wash our hands frequently, especially if you are not vaccinated. If you are 16 and older, get vaccinated. If you are sick, stay home. We are hosting pop-up testing events this week. You can pre-register for the pop-up testing online at covid19usvi.com/testing. Our upcoming events are St. Thomas at Home Depot on Tuesday, April 27th from 1 to 3 p.m. St. Thomas Fort Christian parking lot, Thursday, April 29th from 1 to 3 p.m. St. Croix Canagata Rec Center, Tuesday, April 27th from 10 to 1 p.m. St. Croix Bodo Park, Thursday, April 29th from 10:30 a.m. to 1:30 p.m. And St. John, the Vipa Gravel Lot, Wednesday, April 28th from 1 p.m. to 4 p.m. Testing is readily available to everyone, and especially to those who suspect they may be sick or may have been exposed. We do not recommend the pop-up testing for individuals that have been vaccinated that are not sick. Again, the vaccine is also accessible to anyone 16 years old and up, and getting vaccinated is simple and free, and I encourage everyone to make their best shot against this virus. We are getting good participation from the community for vaccination. So far, 35,707 first doses have been administered, and 25,224 second doses, for 60,931 total vaccine doses administered. We previously announced that we have paused the use of Janssen vaccine in the territory. That still stands. The Advisory Committee on Immunization Practices, the CDC, and Food and Drug Administration have recommended the resumption of the Janssen vaccine. The department will resume distribution of the Janssen vaccine after the official CDC publication is released tomorrow, and after the healthcare community is updated on the latest considerations. The extensive review has concluded that the Janssen vaccine is safe for use, and the department will confidently resume its use in our targeted populations. The Pfizer and Moderna vaccines are still available. If you are interested in scheduling an appointment to get vaccinated, please call 340-777-8227 or visit us online, where you can also book your own appointment at covid19usvi.com/vaccines. Reminders, on May 10th, the community vaccination centers will relocate from both UVI campuses to the Nissan Center on St. Croix and the Community Health Clinic at Schneider Regional Medical Center on St. Thomas. Pregnant women should be extra cautious about COVID. We continue to see positives in laboring women presenting for delivery. This population is also at significantly higher risk for increased morbidity and mortality. Pregnant women should wear a mask, avoid mass gatherings or crowds, avoid non-essential travel, wash their hands, and get vaccinated. Moreover, the entire population should continue to do the very best to prevent COVID-19 infections by becoming vaccinated. Dr. Ty Hunt-Caesar, our infectious disease physician, warns the public against the long-term complications of even those with mild COVID-19 infections. She reports more and more presentations of the long hauler syndrome. Patients with COVID-19 long hauler syndrome have persistent shortness of breath, fatigue, loss of taste and smell, and significant neurological impairments such as memory loss and lack of concentration, or what is described as, quote, brain fog, for several months and up to a year later. This is not due to a prolonged infection. These people are not contagious and their symptoms are chronic. The good news is that last week we significantly increased the amount of monoclonal antibody infusions. Remember, if you test positive for COVID-19, please ask your provider if you are a candidate for this life-saving medical countermeasure. Monoclonal antibodies are available in the territory at each emergency department for rapid infusion if you have mild or no symptoms. This will help you recover quickly and prevent you from becoming a more severe case or risking death. To keep up with the latest information, please visit the U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19usvi.com. And for COVID-19 health information alerts, text COVID-19 USVI to 888-777. Thank you.
Thank you, Dr. Ellis. And for the information that I know many of you tune in and anticipate weekly, last week the Department of Finance issued 3,537 CARES Act 2 stimulus checks totaling over $2.7 million to Virgin Islands residents. The Bureau of Internal Revenue submitted a listing of approximately 1,700 names to the Department of Finance for processing this past Friday. This represents the total number of individuals who have only recently filed their 2019 taxes or had issues with their recently resolved filing. Those checks, those last 1,700 checks, will be mailed out this week. That represents the last issuance of the CARES Act 2 or the $600 stimulus payments. Although the deadline for making claims for this stimulus payment ended on March 15th, we have left the door open to allow as many people as possible to be issued checks under that funding. There were two compelling reasons for that. First, we don't want to have to send any of the funds back to the federal government unexpended or unutilized. Second, and relatedly, the funding is intended as a stimulus for the local economy, and we can achieve that stimulating effect if we don't issue checks to the qualified Virgin Islanders. However, after this week, if you have not received the CARES Act 2 stimulus payment, you will have to file for that payment on your 2021 income tax filing. This is because the Bureau of Internal Revenue has already begun adjusting the system for the requirements to screen for the new American Rescue Plan stimulus payments or the $1,400 stimulus payments. The eligibility requirements for this payment are slightly more stringent than the prior two stimulus payments. BIR will be sending a total of 10,000 names to the Department of Finance for processing this week. Those payments will start hitting mailboxes as early as next week. The Bureau of Internal Revenue and the Department of Finance will process 10,000 payments each week until all checks are issued. We anticipate that by the end of May, all payments under the $1,400 American Rescue Plan would have been made. If you have a question about your eligibility to receive a stimulus payment or the status of your stimulus check, contact the Bureau of Internal Revenue at their hotline number, which is 340-714-9325. Again, that number is 340-714-9325. A few important reminders before we close this afternoon. The Emergency Rental Assistance Program is open to residents in the community who need a little extra assistance with their rent or utility bill. And for more information on how to receive assistance under this program, you can visit the Virgin Islands Housing Finance Authority's website at vihfa.gov/ERAP. That is vihfa.gov/ERAP. Or you can contact the Virgin Islands Housing Finance Authority at 340-772-4432 or 340-777-4432. Those numbers again are 340-772-4432 or 340-777-4432. Likewise, the government of the Virgin Islands was successful in getting approximately $8.5 million from the U.S. Department of Treasury to provide mortgage assistance to Virgin Islands homeowners who have fallen on hard times due to our public health responses to the pandemic. The program will provide relief to residents who are behind on their mortgage payments and who meet the qualifications set forth by the federal government. Like the Emergency Rental Assistance Program, this program will be administered by the Virgin Islands Housing Finance Authority, and we will have more information to share with the public on the mortgage assistance program before the program opens. At this point, we will take any questions from the media, and I am not seeing anyone here on the dashboard, and so I will assume that that means that we do not have any questions this afternoon. So that concludes our press briefing this afternoon. Please remember to wear your mask, practice social distancing, and go get the vaccine now that it is available. We will see you next Monday. Thank you.